Welcome to the village. So my guest co-host today is Mary. She is a licensed clinical social worker. Hi, Mary.
Hi.
Thanks so much for being here.
Thank you for having me.
Yeah, I think it's going to be a great episode today talking to you because mental health is such just an important topic. More and more struggles with mental health.
Yes.
And in your field, you deal with a lot of this all day, every day.
Mm-hmm.
So maybe you can give us some insight and we can have a discussion about what's been going on, what we've been seeing, and if you have any tips and resources, especially given teenagers and adolescents and the worsening struggles with how their atmosphere and their environment has been, particularly with COVID, but even prior to that.
Absolutely. One of the things that I'm very excited about is this program that I'm sort of heading out with in our community, and that's integration care. Right now I'm talking to a doctor, pediatrician, and I'm a social worker. And when we have a case together, it's going to be treating the whole person.
Yeah.
And that's something that historically has been segregated. You know, you had the medical person over here and you had behavioral health over there. And so many times this all comes together. You have to look at the whole person.
Yeah.
I'm sure you've seen young patients that have behavioral difficulties or struggles, and you can do the medical piece of it and maybe even start a medication. But how wonderful it is that we're bringing behavioral health here to you so that we can work together. And so I think, and I speak for our community, I see the impact of poverty in our community all the time. So one of the things that's terribly difficult for me, as it is for you, is so often when children are brought in, it definitely could be a mental health issue or like something like ADHD or bipolar, but so often our children come in from very dysfunctional homes.
Yeah.
So I spend time with this child and I care for the child and knowing they're going to go back to that chaos. And that's very difficult. It's very difficult to be with children from homes that have disintegrated, that, you know, divorce or what have you. And they have so many mothers and fathers in their life because there's a series of that. I think especially with children and teenagers, it's tough.
And as you mentioned, you're with them for this time limit and then they go back to that environment, and environment is a huge aspect with our mental health and our emotions, especially for children, right? Because they depend on their environment. They depend on this mother and father, or then the mothers and fathers and mother and father figures, because it's such a critical period, their development, and they have a lot of dependency emotionally.
Oh, absolutely. And there used to be, and as a doctor, you can tell me this, but is there still the theme of failure to thrive?
Oh, absolutely, yeah.
And I worked with someone that had experienced the death of the child, but that shows you what kind of impact it had. I mean, for a young child, for an infant or a toddler, their environment is everything.
Yeah.
So what happens to a baby if they don't have speech yet? So what happens to them when they don't get fed when they're hungry, or when their diaper isn't changed and it's burning, or when they aren't held enough?
Yeah.
I mean, it is such a strong psychological impact.
Yeah.
And we know that as adults, oftentimes we'll see personality disorders that absolutely stem from that lack of nurture.
You say, that cliche, everything starts from childhood, but it's so true.
Oh, it is very, very true. Yeah. And so many times you'll talk to these adults who had not the good nurturing kind. So what happens to the child of alcoholics? They might sleep through the night without getting up to change them.
Yeah.
Or what happens to the poverty when people don't have food to feed them. It's a very, very daunting thing because they grow into their adulthood carrying very serious mental illness. And that's a life sentence if it's not treated.
Some parents recognize these issues. Some teachers might.
Absolutely.
There's many adults around to recognize or to just think about it, but there may not always be that click in their head that something should happen or that this should be addressed.
And for many different reasons, the parents may be mentally ill or have mental health issues so that they don't recognize it. They may not have the resources. And let's face it, I mean, with insurance and in our community, finding someone is very difficult. So there's all kinds of things that, especially for children, are very, very hard. I know our children's clinic is booking way out. And it's very sad.
that was an issue pre-pandemic, and it's even more of an issue now.
It is now, yes, it is.
Getting on a waiting list that's months and months long.
And I think lots of times when I talk to what don't like, but the term I guess I'll use is good parenting or good parents, and that's kind of judgmental, but when they absolutely assume that all adults feel this way about children. Oh, they're my life, they're my everything, and as it should be. But some parents have never been given those tools.
I guess it could stem from their own childhood, right? Where if you're not given a certain upbringing,
absolutely,
you may not feel that way. Or some parents try to do the opposite and then try to be that extra nurturing parent, but sometimes their own mental health, like you said, a personality disorder, doesn't allow them to behave that way.
Absolutely.
And like you had said, there are certain populations, right? Maybe an abused parent, a single parent, or a child with a certain mental disability.
Yes. Yeah.
There's more of that risk factor of having mental health issues or depression, anxiety.
Yes, and it's very sad to see some of these children grow up in chaotic or abusive homes, and you see them in the classroom, they can't sit still, or they're fighting with other people, or they're very, very drawn. They don't interact with other children. And that's a sad thing to see, because a child has the right to be a child. Very young children, you can see it in them,
That's so well said. A child has the right to be a child.
Oh, absolutely. And absolutely.
When that's taken away from you, how do you expect to recover from that?
Absolutely. I had a case where the grandmother was the caretaker, and she had several strokes. And the daughter, who's the mother of the grandchild, brought the grandchild and was sort of just left her with grandma. And that little 5-year-old girl, I've known her for many, many years, but she grew up taking care of her grandmother. She was cooking, turning the stove off when she was 5, 6, 7 years old. So she took care of grandma, and so she has some issues right now, but understood.
What kind of issues does she, if you are able to
she's
share?
very, very angry. She's a teenager now, young teenager, and she's angry, and she's depressed, and she's empty and broken, and and I say broken not because people don't say broken naturally, but if it can be helped. But she right now doesn't have much of a life. She isolates. She cuts.
Does she understand the reasons why she feels this way, or is this something you helped her to understand why she may be feeling this way?
This is another issue because we worked very well together. And yes, some of the time she did understand it. And sometimes she would feel terribly guilty for not wanting to be there, to want to be out with her friends. So she would carry guilt. And there were times when she understood. However, it's continued. So this is an example when I say, you're working with these young people. You send them back to the same situation.
Right.
And you never know when it's going to trigger something.
Right.
So, if grandma gets sick and has to go to the hospital, she has feelings about that. And she's just the caretaker.
And caretakers, as it is, have feelings of anger and depression and
very
being
much
overwhelmed and guilt.
Very much so.
That desire to want to do something besides take care of that person.
Very much so.
We're all human. It's hard to take care of a person even if you love them.
Especially as a young child and a teenager. I mean, when I was a teenager, I wanted to be with my friends. I wanted to go to the movies. I wanted to go to the dances. I wanted to do, and she's not been allowed to do a lot of that.
Her circumstances.
Absolutely.
So she's losing her childhood.
Absolutely.
What do you say to these teenagers, and whether it be this particular teenager or other teenagers dealing with whatever is making them angry? Even a teenager who's just angry because they're a teenager and they're going through changes and they're not allowed to do everything they want to do. How do you deal with that? How do you tell parents to deal with it? Or what tools can you give the teenager themselves to deal with something like this?
Teenagers are particularly difficult to work with.
Yes, that's true.
Especially to teenage boys, I would say, especially with talk therapy. That's difficult. And everybody's different, has a different style. Sometimes I can't reach them. They just shut down. I have a particular problem if parents drag their child in and say, fix them, fix them. And it's like, well, wait a minute. And they will sit there and they virtually will not talk. And sometimes it works. And sometimes I will reach out to another therapist that I know and say, I'm not reaching this kid. Can you try to meet with them, or can you give me some feedback? just reach out. I would be working
Oh,
with
yeah,
you.
yeah.
If you had a patient, I would be
Yeah.
saying, doctor, what do you think what will
Okay.
work for this? You just do whatever you can. I like to know the family background, because why is this young man or young woman so angry? What happened?
Yeah, to talk to other people, like a group
Absolutely.
counseling or.
Absolutely. There's different avenues to go. Yes, there's groups, there's, teachers that are involved in their life. Sometimes, I'll be told by a
Yeah.
parent that there's this teacher that he really
Right.
likes.
Right.
I will do anything I can to try to break that barrier down, but sometimes it doesn't work, and you
Or
have to.
a coach.
A coach
Yeah.
is very valuable, but it's very interesting. One of the things that I really enjoy is doing family work, because although it can be painful at times, but when I see the interaction, like if I meet with a young person, they have issues, anger issues or whatever, and then lots of times when you bring the family in, or the brothers, whoever, you bring the family in, you can see the dynamic right away. The mother's, an angry person, but dad doesn't recognize, or mom and dad are bitter and they don't converse, but you can see the anger.
Yeah.
And it's just, suffocating. And so, so it's very interesting to see what I think sometimes parents are so close to the issues that they don't clearly see them.
Yes, they're within a system and they may be with their own stressors.
Absolutely.
So then it's up to really anybody beside the parent to point out that something's going on. So I think that's the beauty of pediatrics, because we are supposed to really care for the whole child, because
yes,
they very rarely have significant medical problems. Part of your health lifelong is going to be your schoolwork, your mental health, your socializing.
Yes.
So then figuring out at their annual checkups, we actually do depression screening. We talk to adolescents separately and talk to them about their feelings and how they're doing, making sure that they're being taken care of by a provider who looks out for those things, because how can you do everything as the parent? It's hard when you've got so much on your plate.
Absolutely. It's very difficult.
Yeah.
And I don't want to blame parents, because the parents came from someplace too.
They're human beings.
They're human beings, and I'm very, very open-minded in the sense of saying, okay, your mom or your dad weren't given the tools.
Yeah.
Because of something in their life or their past, so they don't have the tools to work with it. So then if you're working with a family, it's very nice to try to teach that or role model it. But sometimes it's the child having to accept dad's an alcoholic and he's not going to be emotionally there.
Yeah.
And you have to walk a fine line with that. You want the child to try to understand without blaming.
Something I heard about recently was kind of what you're suggesting, accepting that whether it's your parent or a friend or anybody in your life that's important to you, you can't make them the person you want them to be.
Exactly.
Yeah.
That's teaching patience, and it's teaching understanding and empathy and all of those wonderful things that sometimes children are given or aren't taught.
Yeah. And yes, teaching children and adolescents that very essence of life in the world, that you may not have it this way, this is the ideal way, because they'll never, that your friend or your family member, these people will never be anything but themselves.
Exactly.
And if you can accept that and appreciate what they have to offer you as a parent or as a friend or as a teacher or as anyone or as yourself, like you may not have the ability to do this and this, but enjoy the other abilities you have and how you contribute.
One of the most simplistic ideas that I see is self-esteem issues.
Yeah.
If a child is at school and her best friend doesn't talk to her, she feels that it's her. That it's her fault. That she's
rejection.
Not good. Yeah, the rejection.
Yeah.
Children who can handle that in a very positive manner are children who have good self-esteem and confidence. Yeah. Not over the top, but really healthy self-esteem. And I believe that comes from coming home and having dinner with your family and being able to say, this is what happened at school today. I feel sad about, I'm older, so I feel sad about the kind of community I came from, which was very family-oriented. We ate dinner together every night. That doesn't happen very much anymore. I also, not popular, but I blame a lot on social media. I know a family where the child is upstairs doing whatever on the computer. Mom calls her on her phone
Yeah.
to come down and get a piece of pizza.
Right.
And that's not building communication.
Yeah.
That's not enhancing or self-esteem.
Yeah.
A child or a young adult or a young teenager, they have to know that they're cared for. And the only way they're going to know that is if they know the rules. And the rules are healthy.
Children need structure. They
Structure,
depend on
absolutely.
it because they need a security. And without structure, there's no security. And one thing leads to
Absolutely.
another. And then you don't have that feeling of safety.
You know, I'll tell you a story from my own life. When I was much younger, 13 and 14 years old, we used to have, and I don't think they have them anymore, we used to have school dances. The only way that I could go is if my mother, my father, both my brothers were 10 years older than me. They were both policemen. So my friends and my family, they would take us to the dance and pick us up. And I used to know a girl that used to walk home with a bunch of kids on another part of the town. And I used to be so jealous. I wanted to walk home and not have to be home at a certain time. And I was and years later, she and I were talking and she said, yeah, but Mary, you knew somebody cared about you. I never did.
Wow.
Because she'd get home, her parents were divorced, mom would be in bed, you know. I mean, she'd come home anytime she went. I thought that was the coolest thing.
Yeah.
And now that I think back on it, honestly, I knew I was safe.
Right. And that's something that children, even little kids, don't even know that they know within them.
I didn't know that I knew.
Yes, yes, exactly.
I did not. But when I think about it, when she said that to me, I thought, oh my gosh, that's so true.
And having that builds you up for more success of being able to handle what life throws at you. So with less of the mental struggle of the anxiety, the depression, the self-esteem.
Absolutely.
One thing leads to another.
And you put that very, very well because it's so true. You have to prepare your child for the world. And so many of these kids are not prepared.
And you can protect them by preparing them. Parents feel like I need to protect them by not letting anything bad happen ever.
That's right. That's right. Yeah. And how do they ever feel accomplished? I mean, it sounds foolish, but if I can overcome a hurt or situation, then it builds my confidence that I can overcome things. They don't stop me from growing or developing. But
like when you say, I've been through that, now I can do anything, that's where that comes from. So you think that quality time and communication, sitting down at the dinner table, and if sitting down at the dinner table is not possible because of work schedules or other reasons why that's not possible, but like a quote unquote sitting down at the dinner table. So like a time, I have a patient who, the parents are wonderful. They're very involved. The mother is a teacher. The father is involved as well. They're like a married family with 2 kids, a boy and a girl. And those teenagers are so anxious. They just have a genetic anxiety. I guess or maybe there's something else I don't know about, but it just seems like they're set up for a successful transition into adulthood, but they're so anxious. The mom had talked to me about the daughter in particular. She seems to have a little bit of OCD too, so obsessive compulsive disorder, which is an anxiety disorder, and it is genetic. It's not really possible with schedules to really sit down and do the talking one-on-one until right before bedtime and every night. And it was the child's counselor who advised mom that mom and daughter will sit down for an hour every evening, and they do it a little bit before bedtime, like I said, and they'll talk about her day, what's bothering her and how she's feeling and where to go from there. So that's why I say quote unquote sit down at the dinner table, because it may not be precisely a dinner table, but I guess the idea is find that time to have a conversation with your child about what the day was like and what they're feeling. You can talk too, right? You can say how your day was, how you were feeling. Maybe the child will see your point of view.
Oh, absolutely. And, you know, it's interesting because I do this so naturally as you're talking about this family. I'm saying, well, wait a minute. What about that? You know, like, well, where do they work? Why aren't they able to sit down at the table? I would wish one day even a Sunday meals could be together.
Oh, yeah, a once weekly
Yes,
thing.
once weekly,
Yeah.
that would be a tradition because
Yeah.
traditions build confidence. Healthy traditions are very powerful. And yes, I think it's very important to role model for your child something that has hurt you or something that you've struggled with and role model problem solving in that way.
Yes, role modeling is so important.
It's very important. And even to share things as I just did, if you could say, when I was younger, when I was your age, I went through something very similar. And this
Yes.
is how I handle it. So you build that relation. You don't want to twist it into a helicopter kind of parenting where it's smothering.
Right.
And that's a hard thing because you love your child very, very much. But you can overdo that. I mean, you can overdo that behavior with behaviors.
Right. Don't coddle,
Oh.
I guess. I guess you have experience with seeing some coddlers.
Yes, absolutely. It's difficult. You want to give that child an experiences where he does have to problem solve, where he learns that even if he isn't successful at it, this is what what did you learn from it?
Right.
Well, the next time I would do this. Not to be defeated by something that doesn't work,
Right.
but to go back at it again.
Right. Don't give up.
Right,
Just
absolutely.
struggle through it. I'm here for you with that struggle.
You have you have his back, but you don't do it for him.
So having said that, I guess another way of kind of molding your child to deal with these stressors is to maybe put them in situations that could be stressful. So sports, activities, learning an instrument,
Yes.
music. So push them to learn and grow and be in a team and challenge themselves.
Yes, and understanding if the team or the loses, that's okay. You played a good game, or that happens.
Yeah.
Yeah, of course that happens.
Yeah.
And to normalize that rather than blame. And I do see a lot of that. I saw something on Netflix one time. I'm trying to remember the name of it, but it was a true story about parents who were at a child's game, a baseball game,
Yeah.
and the parents, two fathers went at it, and the one was killed.
Wow.
They were fist fighting, and
And this is a true story.
It was a true story, and it was all over the news. I remember when it was all over the news. They were fist fighting, and the one father fell. They were in the bleachers, and he hit his head, and it was a huge story. And there was a lot that came out around that time about sports and how valuable it can be if it's handled correctly.
Right.
But my point is that adults can ruin it
Yeah.
too. I mean, they can when they put too much pressure.
Right, too much pressure from the parents.
Absolutely.
Being a perfectionist. So
Absolutely.
sports are meant to build
Teach.
sportsmanship, teach, and have a good experience, build a skill that may become a lifelong skill that they have for their career or their lives, or maybe something they did in school to build who they are.
Absolutely.
Athletics. But yeah, without getting unhealthy about it and not raising a sore loser.
Exactly. And it's the same thing with grades. And this is well known. You don't say to a child, you got a B, you could have gotten an A.
Yeah.
You sit down and go over the whole,
Yeah.
and if they have a low score, you sit down and say, okay, what do we need to do?
Right.
And you don't shame that child.
And explain to them, this is why getting a low score will affect you. Not because I want to see these grades, but I think that you need to get higher scores because then you can meet your goals in life one day with this.
Also, that's very true, but I want to sit down and know what it is about this particular maybe it's the teachers that are teaching so that he can understand. Maybe he's got a different learning style. Maybe we can put things in place or whatever to bring that grade up if that's something within his ability.
So really avoiding the blame, and of course there should be, they don't say punishment, but withdrawal of privileges. Right? If you're not doing what you're supposed to do, your responsibilities as a child, because you have to bring something to the table as a child as well.
Correct. One thing you want to do, and this is another thing that I pray for in these families, is you never want to give any kind of, again, punishment is not the word, but you never want to give anybody a withdrawal of privileges that you can't live up to. Have you ever seen a parent look at a young child and say, if you do that again, we're leaving, and they don't leave?
Yeah, right.
Do it again, we're leaving, and they don't leave. That child's going to stop listening.
Right. They know.
Because you don't mean what you say.
Right.
I've had parents say, you're grounded for a year, and I think, what?
Right.
You don't want to give them impossible kind of scenarios where they are shamed or they're angry or it's just not healthy. And when you do withdraw some privileges, you want to sit down, explain exactly what they are, how long they'll be,
Yeah.
and this is something that you can handle
Right.
and he can handle.
As the parent, that
Yeah.
you're actually going to do this.
Yeah, but I've heard parents say the funniest things. It's like,
Yeah.
a year? Really?
Right.
You know? It's important. So, somebody said to me, a child can't play a game if he doesn't know the rules. Well, that's
Right.
true with life.
Right. Exactly.
Yeah.
You need to know the way life works.